Welcome back to a new week and a brand new episode of the Granny Panty Podcast. I'm your host, RubyLynne. If you'd like to follow me, please head on over to RubyLynne.com where you'll find everything Ruby. This week's guest is an expert in his field. He is the medical director for the LA LGBT Center. He's also a board member for PASS, which stands for Performer Ability Screening Service. He brings so much knowledge, medical knowledge, and advocacy for adult performers. I'm excited to talk with him today about testing protocol for adult performers and some new tests that are needed for performers. So help me welcome Jamey Bell. Jamey, I'm so excited to have you on the show today. You are really my first expert in the medical field on my show, and I was compelled to have you on because there's so many questions out there about what's going on, some from myself. I was also able to get some emails from people asking questions, so that's always exciting to see what kind of information is needed out there. But I'd love to start off and have you tell me kind of about your background and how long you've been in the field, when you became a PASS certified board member, and tell us about you.
Great. Well, thank you so much for having me, Ruby. I'm so happy to be here. So I've been in the field of HIV, STIs, LGBTQ health for a little over 20 years now.
Wow.
So right out of the fifth grade. No, but
Right.
no. So I've worked in community health settings. I've worked homeless healthcare clinics. But primarily, my passion is sexual health, and I'm currently the medical director for the sexual health program at the Los Angeles LGBT Center. And I've been here going on 6 years at the center. And I have a lot of patients who, especially being here in Los Angeles,
Mhm.
who are in the adult industry or who are sex workers. And I'm just very passionate about being able to provide safe, non-judgmental care for folks in
Mhm.
the industry. I've unfortunately heard, horror stories of how
Right.
how folks can be treated out there. And at the LGBT Center, we are very welcoming of sex workers. There's no judgment. It's all about
Mhm.
respect and taking care of your health. So by training, I'm a nurse practitioner, and I've been a nurse practitioner for 14 years now. Prior to that, I was a registered nurse. And let's see, PASS. I think that was your question as well. So I've been on the board
Yes.
of PASS for almost 2 years now.
Okay.
The board of directors, yeah.
Wonderful, wonderful. Well, they are so lucky to have you at
Oh,
your center.
thank
There
you.
definitely needs to be more of that. What caught my attention, how I discovered you, was during this recent, or in the past few months, the chlamydia outbreak.
Yes.
Different vaginal, anal, throat, different chlamydias. So I kind of wanted to start off and talk about that. As we discussed before I started recording, I kind of have a background in social
Yeah.
work. My caseload tended to be a lot of HIV, and that's where my education is too. But even for me, the whole anal and throat chlamydia, the throat I can kind of understand, but the anal,
hmm
how did we start discovering that?
Yeah. So, in community health and STI clinic, we historically have checked when we test for gonorrhea and chlamydia. We historically have done throat swabs, either urine or vaginal
Mhm.
swabs, and rectal swabs. So we know that there's a large percentage of cases of gonorrhea and chlamydia that are what we call extragenital, or not in the front, basically.
Right.
So throat or anal. In our particular population, it's upwards of 50%. of our positive gonorrhea or chlamydia are not genital. So
Okay.
pretty high. Statistics in the general population are probably somewhere around 30% of cases are
Okay.
extragenital. So, you kind of figure with the adult industry,
Mhm.
somewhere fall range. And I think there's been a lot of confusion. Folks, you know, uh, felt like if they're getting a urine test,
Mhm.
that's checking them for gonorrhea and chlamydia,
Mhm.
but it's very site specific. The infection can be in one location, it can be in two, or all three. So very important to check each site
Mhm.
separately. Yeah,
Okay. Okay. And, is PASS recommends that as a standard protocol now, correct, for
correct.
adult creator testing?
Correct. Yeah, started around the first of the year.
Okay.
It's something that we had, been talking about for quite a while, and
Mhm.
something I know Ian O'Brien, who's the executive director of PASS, and myself, something that we both felt very strongly about. And I think it took this recent outbreak
Mhm.
to I think really move things forward. And I think performers then said, hey, we want to be safe. We want to make
Right.
sure we're fully clear.
Right.
Yeah.
Right. That's awesome, and I had some questions. I asked my viewers and my fans and my
Yay.
subscribers, on Twitter to send in some questions, and I had some
Great.
specific to that, so I wanna have you maybe address them.
Sure.
So this person asked, how is chlamydia showing up on the rectal swabs when there's no symptoms? Or I guess it would apply to both throat and
Yeah.
rectal without any symptoms.
Yes. So, yeah, that's a very good question. So, especially in the case of the throat, gonorrhea and chlamydia, 90% of the time is asymptomatic, no symptoms in the throat. On the occasions that I do see patients who have throat symptoms of gonorrhea, it often mimics strep. It's pretty painful, red, and swollen, but the majority of the time it's going to be asymptomatic. With rectal infections, it's somewhere around 50-50. There may be no symptoms, especially in the case of chlamydia.
Uh-huh.
There tends to be, fewer or milder symptoms than in the case of rectal gonorrhea. And even, in the urogenital in the front, some folks just never develop symptoms. Um,
Okay.
so yeah, that's even more reason why it's so important to screen because of the
Yeah.
asymptomatic. Yeah.
If they were having symptoms, what kind of symptoms are common?
Yeah. So if it is in the genital site, it's going to be burning with
Okay.
urination, abnormal genital discharge. Sometimes that varies though. Some folks will describe it just as a little abnormal itching or tingling or something feeling not quite right to all
Okay.
out really severe discomfort and the discharge. And same with rectal, it runs the gamut of just some abnormal itchy discomfort to you know very uncomfortable pain discharge.
Mhm, mhm. And would the symptom be like sore throat, swelling, anything like that?
Yes. So if there are symptoms, again, most of the time there won't be in the throat, but if there
Okay.
are, it would be a sore throat, redness, swelling. Yeah. Often looks like strep. It can fool us sometimes.
Gotcha.
Yeah.
Okay.
But the majority of the time, we have folks come into STI clinics saying, I have a sore throat. I think I have an STI. The majority of the time when they have symptoms, it's not an STI. But
Okay. Okay. Interesting, yeah. I wondered about that as well. That was a good question. I
yes.
have another question from I'm assuming a performer who said, I perform and do collaborations with other people, get tested. My boyfriend, however, doesn't shoot with anyone and has only had sex with me, but got testing and tested positive for the rectal chlamydia. How can that be if I tested negative and he tested positive?
Mm, okay. Those scenarios are tricky and they do happen. Tests are not 100% accurate. I mean, they're
Okay.
highly accurate, 98, 99. But, when you're testing as frequent as folks in the adult industry,
Mhm.
need to test, you're kind of statistically bound to occasionally possibly get a false negative. And the other thing is, there's a little bit of room for human error. We have
Okay.
folks do self swabs. Um, and, even though it's a pretty simple procedure, it's still,
Mhm.
the human error is kind of built into there as well. So those are hard to answer for sure. I
Okay.
mean,
Okay.
and in those cases, I mean, the recommendation is I would treat someone if their partner tested positive.
Mhm.
Um, and without knowing the whole history, where they, had they been treated for an STI in the past, maybe they cleared it, the partner was carrying the bacteria and was asymptomatic. So it's a
Gotcha.
little tricky to know sometimes. Yeah.
And can that harbor for years? I mean, could it be that the male partner may have just had it for a long time and never tested for it? Or
It's possible. It's
okay.
possible. So generally over time, the bacteria will cause what we call secondary infection. So
Right.
potentially a prostatitis or an infection in the testicles, things like that, where the bacteria moves. It was asymptomatic initially. How long that takes, it just varies, among individuals. Women who may have chlamydia or gonorrhea for a lengthy period of time and not know it are at risk
Mhm.
for developing pelvic inflammatory disease or PID. Those things are much, less common in folks who test regularly, though, to
Okay.
have complications. So I don't want people to think, like
Right.
that's a common thing. We see that in folks who don't test regularly, then they're more prone to developing a secondary infection.
Gotcha, gotcha. And that similar question, I feel like when the outbreak really went wild in January, that I saw that a couple times,
Yeah,
performers posting my partner, tested positive or negative and vice versa. One of them was
yeah,
positive, one was negative. So that can
yeah.
be very confusing.
It is very confusing, and I definitely saw a lot of patients coming in with, results that, had discrepancies like
Mhm,
that. And
mhm.
so then we would usually retest and then
Retest.
treat appropriately. And again, it can be hard to know sometimes why those things happen. There was an update to the gonorrhea chlamydia assay that we use
Right.
last I want to say, yeah, probably middle of last year, like a newer generation of that test. And so we
Mhm.
never know, was the lab using the most sensitive test at the time? Were they not? Was one using one? And
Right.
so to my knowledge now, I think all of the testing labs, everybody's on the same, version of the test. So
Good, good.
yeah,
That's good because I'm also seeing a lot of new labs for adult testing popping up, which is good, but then
yeah,
also the question is everybody testing for the same thing?
yes,
We hope,
yeah,
and hopefully well, we know of one that's decided not to report to pass, but the
yeah.
importance of reporting as well.
Yeah, I mean, and the importance is that just then, there is some oversight of, what's being tested,
Mhm.
the methodologies that are being used, and just, it standardizes for folks. I know the newer labs that have come on recently are part of PASS,
Yes.
so that's great, and yeah, so that's the goal, just so that we have a standard, an industry standard among
I
all
like
of
that.
yeah, absolutely.
I like that a lot. And I live in a very dry area for labs or performers. I'm in Portland, Oregon. So
Yeah,
there's not a lot out here, but I'm hoping that some of the newer labs will contract with, draw stations and stuff here so that we can
yeah,
utilize that.
yeah, and I believe that's the plan. I know we're
Mhm.
at the LGBT Center in LA, we're working closely with Clear now
Nice.
to provide treatment for folks who test positive for STIs through the Clear lab, so that there's a treatment, mechanism, or I'm sorry, a referral mechanism for treatment.
That's good because some people don't have insurance, they don't have primary care, and so
Right, right.
that is awesome. I love hearing that.
Yeah, and on those lines, I mean, it's really our priority to make this, as affordable as we can for folks. If they have insurance, we can take insurance. If they
Mhm.
don't, we're a federally qualified health center, so we can see folks on sliding scale or
Right.
other programs. Um, because I understand the testing in and of itself is very expensive, out of folks' hard-earned income, and so I don't want the treatment to be costly as well. And so, fortunately, we're able to get the medications for no cost for folks. So I'm really excited about this partnership with Clear.
What a great program. I
Yeah,
love that. Yeah, testing is crazy, especially when you live in an area that you don't have
yeah,
a Clear or any of the testing
sure.
locations. You're not only paying 225 or whatever for to order your test, but it's like another 100 bucks just for the draw and all that.
Um,
It
I
starts
know.
to add up. I always
Sure.
joke that before I go to an event, I'm already, $350 out the door before I made a video.
Yeah, I know. That's not good.
So let's move on. I personally have a lot of questions about the Mgen.
Okay.
That's not anything I heard of when I, did my public health degrees.
Yep.
Gosh, 10 years ago. I never
Hmm.
heard of it. So can you
Yeah.
speak to, where did that come from? How did that all come to light? And then, symptoms, treatment, and should we be worried? I've seen a couple things on Twitter. I've saw some performers that said, "If you're not MGen tested, I'm not shooting with you." But then I saw
Yeah.
a tweet that you did that said, "We really shouldn't be that worried about it." So can you talk about that and
Yeah.
clarify that?
Absolutely. So I think MGen was discovered like in the early 1980s as a
Okay.
bacterial infection, that can cause symptoms very similar to gonorrhea and chlamydia. So again, like we talked about, it could be the burning with urination
Mhm.
or abnormal genital discharge. Um, Typically, I mean, there's been no standard, even up till now, we have no actual CDC recommendations for routine screening for Mycoplasma genitalium or MGen. So it's historically been a diagnosis of exclusion. So, you know, if we test a patient for gonorrhea and
Mhm.
chlamydia or any of the other common infections that can cause these symptoms, bacterial vaginosis, trichomonas, UTIs, when
Mhm.
we've ruled out all of those other infections and a person is still symptomatic, it's appropriate to test for MGen. That's kind of how, up to this point, that it's how we've just done it clinically, but it's really emerging as a newer STI now. And CDC does have treatment protocols. Unfortunately, MGen quickly became resistant to
Ah,
the initial treatment protocols. So
okay.
things like azithromycin or
Mhm.
doxycycline by itself, a lot of resistance. So it's a pretty aggressive treatment regimen now of 14 days of two
Okay.
different antibiotics. So kind of harsh. So how we have been approaching it, at least in our
Mhm.
STI clinic, is if a person is still symptomatic, we will do the test, or if they have a known exposure to MGen, their
Okay.
partner did test positive. Now, we don't automatically treat for a known exposure because we know that a decent percentage of folks will clear this on their own. So, in one of the MGen studies, over 50% of folks cleared the infection at 3 months,
Mm,
spontaneously or naturally.
okay.
So now, obviously, if we're working in the adult industry, don't have 3 months to
Right,
wait.
right.
And so we those protocols and recommendations, we that's they're just that, they're guidelines. They're not hard and fast for every
Okay.
situation. So I certainly would test somebody in the adult industry because,
Mhm.
if there was a known exposure or symptomatic. Um, As far as it being incorporated into routine testing, I don't think we're quite there yet. PASS is in the process. We're forming a medical advisory board. So we're going to have, several medical experts, infectious disease experts
Mhm.
on this panel to really look at, what we've been testing for up to this point,
Okay.
and do we need to revamp that panel? Ideally, folks should have access to vaccinations and we shouldn't have to check for hepatitis B every 14 days.
Mhm.
That's if a person is vaccinated, then there's no need to check for that. And so I think if we can really look at how we can kind of bring this panel into the current, you know, scientific, what we have
Mhm.
now, the medical knowledge that we have now, because again, it's always in mind of how do we make this the most cost effective for folks as
Right.
well as the most benefit for community health in the population.
Right. Right.
So
Right. Okay, yeah, and there was a clinic, I think, uh, that was sending out the Mgen test. I personally ordered one and got it, but
yeah.
how often do you think an adult performer should test for it? Or should
Um
they, if they don't
yeah.
have symptoms?
So and I think that those are things that we're really going to look at it in the medical advisory board. But personally, at the moment, I don't think every 14 days. I think that's excessive,
Okay,
and not cost effective, because my understanding is it adds on a couple $100 extra to the panel, or up to that.
right,
Uh, and so I don't think that's, cost effective or medically necessary at this point.
okay,
As far as how often to test, certainly if there is a known exposure, I would test. Maybe, periodically, every 2, 3 months, at least now until we have better guidelines. Because again, some folks will clear it
right,
on their own. We know that doxycycline still has some effectiveness for Mgen. So if we're giving doxycycline to treat chlamydia,
mhm,
that would also have some, effect if a person was carrying that bacteria. It's, I think, more to come as we get, more information from the CDC,
okay,
but it's definitely something to be aware of. I don't think it's something to, cause a lot of panic right now. And I think the other piece to that is commonly when you do a test for Mycoplasma genitalium, it's combined with two other organisms, one called Mycoplasma hominis and one
okay.
called Ureaplasma uh, urolithicum. So those two organisms, I know, those two
That's a
organisms,
mouthful.
it's like those two organisms have added to the confusion with Mgen, because so ureaplasma and M.
Mhm,
hominis that are in that panel, those organisms exist in the urogenital tract normally. Okay. And most of the
mhm,
time, they don't cause any problems, they don't require treatment. But folks were getting positive results on those and kind of panicking, understandably, like, I have a positive, lab result here.
mhm,
So, in the absence of symptoms, you would not treat that.
okay,
So you would think of those organisms kind of like, we naturally have yeast and
mhm,
fungus on our skin in the genital tract. We don't treat those unless there's an overgrowth of the organism and you get symptoms, right?
okay,
So what I do now when I test folks for Mgen in my clinic is I only do an Mgen specific test.
okay.
Mgen should not exist normally. It's not colonized in the urinary tract. So if it's there, we want to treat it.
Okay,
Symptoms or not. The other two organisms we leave alone unless, a person is symptomatic and we've ruled out the other common causes.
okay,
So some
okay.
of this, it kind of goes from the screening arena into like medical diagnostics where, folks really should see a medical provider at that point if they've tested negative for the most common infections and still have symptoms. So
Gotcha, gotcha. Thank you for clarifying that because it is confusing, it's
very
should I
confusing.
panic or should I not panic?
Yeah. Yeah, I wouldn't panic. I think it is something to be aware of,
Okay.
absolutely, and something, we're definitely watching closely, and I think,
Mhm.
recommendations, likely will change over time.
Right.
And I know the CDC is watching this now, especially with the drug resistance. So,
Right.
um,
Right.
yeah, so more to come, but I think, again, if there's a concern, definitely test. I would really ask for an Mgen specific test and leave
Okay.
out those other things because what's happened then, folks have been getting antibiotics unnecessarily
Right.
when that's positive, and again, that then contributes to potential drug resistance. So
Right, right, right. It just makes me flash back to the whole MRSA thing when that all became, we all
absolutely,
carry it on our skin, but it just looks for an
yeah.
opportunistic time.
Absolutely. So great. That's a great analogy, Ruby. That's yeah, I use the yeast a lot because yeah,
Mhm.
it's always there, but we leave it alone unless it's causing problems. Yeah,
Right, right. Awesome. Well, thanks for clarifying that.
absolutely.
I had another question come in to my email that someone asked, do you think they said porn performers, but I'll say adult creators. Do you think adult creators should be on PrEP as a standard? What's
Mm.
your take on that?
Yeah. So, well, I'll tell you, I'm very pro PrEP. I'm very much a PrEP advocate. We've seen, new HIV infections decrease dramatically as a
Mhm.
result of PrEP. Um, However, I mean, you really have to look at the individual, situation.
Mhm.
Who are the performers filming with, and not to stigmatize any particular group, but,
Mhm.
if there are crossover performers, then that's possible, that you may want to be on PrEP. And again, not to say that it's only transmitted through, men who have sex with men or anything like that. We
Right,
know anyone
right.
can be at risk, but I think it's very individual. But I prescribe PrEP all day long, and it's very safe and very well tolerated. And I have a lot of performers, both on well, really in all genres, gay,
Mhm.
straight, bi, trans genres who take PrEP.
Okay.
Um, but I think it's an individual thing. I know some folks don't like taking pills every day. They don't like that
Mhm.
idea. There is a new injectable PrEP that's every 2 months. A patient comes in and gets an injection. All of these PrEP methods are over 99% effective at preventing HIV. So, yeah, in general, I'll say yes. I'm very much an advocate for this because anything we can prevent, you
Right.
know but it is very individual, and that's where I think it really requires having a conversation with the medical provider and seeing if this is right for that person.
Okay. Awesome. That was my questions that I had emailed in. Those were some good ones though.
Very good, awesome.
So what do you think is, the most important lesson we've kind of learned with all of these new
Yeah,
STIs, emerging or at least coming more to our attention. I mean, these are things that have been there always, but we just haven't seen this.
sure, sure. Well, I think it's been very exciting for me too to see how actively involved a lot of performers have gotten in this. That shows they really care about their health, the health
Mhm.
of their community. So that's really great. And I love when folks reach out to me on Twitter and, ask questions and I can direct them. I think, aside from the routine screening that we have in the industry, I think it's just very important for folks to establish, healthcare with a medical provider who they can feel very comfortable with
Mhm.
and
Mhm.
disclosing their occupation, disclosing sexual practices, orientation, gender identity, etc. Because again, the stories that I've heard, the unfortunate
Mhm.
stories out there, you know I'm very much like a holistic provider. I believe,
Mhm.
everything's all connected and our sexuality is
Right.
part of that. And so we need to feel comfortable disclosing those aspects of our whole person to a medical
Mhm.
provider to get the best care. So
Right.
we want folks again to feel safe and not judged, to come in and let us know what's going on, and then I can, like in answering the prep question, then when I have a good history, then I can say, yeah, this is the right thing for you, or
Right.
maybe consider this. And so I think that's just so important, and there are parallels with the LGBTQ community and the adult community as
Yeah.
well, because I think uh, both groups, there can be medical mistrust. There's been, discrimination in healthcare for those
Mhm.
groups. So I think when folks, and to me, the biggest honor is when folks come in and they say, I feel so comfortable here. Everybody has treated me so well, from the front desk to the nursing staff to the lab staff to the medical providers, that people feel respected. And to me, that's the greatest, honor to hear that. And so,
We
yeah.
need to clone you. Can we just clone you in your clinic and
Uh, yeah, I mean, and it's tough when folks live outside of major metropolitan
Right.
areas. Most major cities have LGBTQ health centers,
Mhm.
um, where I think that's a good option to seek care. But when you're kind of outside of that access, it gets tricky.
It
You know,
does, it does, and my hope is that more, I call 'em mainstream providers, but, your regular
yeah,
clinics and that kinda thing
yeah,
become more open-minded. I know for me, recently, just, it was, December, January, I had my yearly, you know, pap smear and all that, and, meet with your PCP just for
yeah,
your once a year thing, and I came clean, no pun intended, and told them what, my job
yeah.
was, and I was pleasantly surprised. They were very supportive,
Oh, good. Mhm.
no questions asked. Where I was disappointed is that my commercial insurance wouldn't cover an appointment to go in and talk about, to get a full STI panel because I didn't have any symptoms of anything.
Mm.
So that is an
So
issue. I think those of us who are, privileged enough to actually have access to commercial
frustrating.
insurance, they need to get up to speed. I
They do.
mean, to
Absolutely.
not cover an office visit where you're like, I just want to, do
Yeah.
a complete physical with a full STI panel, even though I'm getting tested regularly, and my PCP said, you're getting more testing by doing an adult performer test than what we would even offer for you to come in if you thought you had
True.
just to get
Yeah.
a normal one.
Yeah. That's so frustrating. It just speaks to the bigger issues of healthcare in our country. But
Right.
I typically, there's ways to do that. I mean, in California, we're very lucky. Our state Medi-Cal program covers, routine screening.
Mhm.
And if there's an occupational risk, I consider that a possible STI exposure, right? So
Right.
sometimes it's in how that you document, why the person's coming in, and fortunately, I've been pretty lucky in being able to, get what I need for my patients, but
That's
that's
awesome.
not always the case. So
That's awesome.
yeah.
Well, amazing information as we close
uh,
up the show. I mean, I love following you. I have learned so much just from your
uh,
posts. So keep it
thank
up.
you. Thank you. Oh, it's my pleasure, my honor to be able to provide the information and to be able to help folks in the industry. I just feel very, very strongly about, having access. So
It's
yeah,
yeah, it is really invaluable, I think. And so we're also glad that you're here and keeping us
thank you,
up to date
thank you so
and
much.
that. Thank you so much for taking the time to be on the show too, and,
My
all the good work that you're doing. It's just so
mm,
exciting.
thank you. It's my pleasure. It was so nice to be with you today, Ruby.
Nice to meet you. Thanks again.
You're very welcome.